male sling is the best option for patients with mild to moderate stress urinary incontinence. It again has no moving parts and enables the patient to improve their incontinence right away. Some patients are extremely dry after the sphincter. Some patients are improved to 90% and only wear a tiny pad, but the improvement is very predictable and the patient satisfaction very high. The male sling procedure is performed on an ambulatory basis. You go home the same day. It's done with general anesthesia. We usually prop the legs up in what we call a lithotomy position. A small incision is made in the perineum, which is the area of the skin behind the scrotum, and the sling introduced through that incision with specialized needles. Patients go home. I send my patients home with a catheter, which is removed the next day, and patients experience improvement of their incontinence immediately. As soon as the patient is awake after the procedure, patients are discharged. Usually they'll stay in the recovery room maybe 2 to 3 hours, and then after they eat and drink, they can go home. As with any procedure that we perform, patient safety is number one. For this reason, we like to obtain a cardiac clearance for patients that are over 45 years old, patients who have diabetes. They need to be evaluated by their primary care physician or an internist to get a complete physical examination and history, as well as blood work. All patients that have the procedure done on an outpatient basis need to arrange for transportation back to their home. For travel patients that are out of state that come by themselves, we have a transportation service available. It's called the discreet chaperone. It is a separate cost. Patients need to reserve in advance a person that will take them back to the hotel or back to their home. Our staff is available to assist in making the appointment. 3 days before the procedure, we request that patients begin washing their skin with Hibiclens twice a day, morning, night. We request that you do not shave any pubic hair. We will be doing the shaving in the operating room. Patients need to take an antibiotic the day before the procedure. Patients need to continue all of their medications even the day of the procedure, especially if they're taking medications for the heart or blood pressure or diabetes. Patients who are on strong blood thinners like Plavix or other blood thinners need to stop these blood thinners anywhere from 3 to 7 days. Please consult your cardiologist or your internist to make sure that it's safe to stop the medications. Patients on baby aspirin needs to continue their baby aspirin even on the day of the procedure. Please do not drink or eat at midnight the day before the procedure. Patients can resume regular diet after the procedure. Please pack lightly when you come to the ambulatory surgery center. Do not bring any valuables with you. You need to bring your ID and medical insurance card. Bring some loose pants in order to be comfortable going home after the procedure. Again, we request that you do not shave prior to the procedure. We will be doing the shaving immediately before the procedure. Shaving in advance increases the colony count of bacteria of the skin and can potentially increase the risk of infection. As soon as you arrive in the ambulatory surgery center, you will be greeted by a nurse. An intravenous or an IV line will be placed and you will be receiving pre-operative antibiotics. You will then be brought to the operating room. After general anesthesia, you will be positioned on the operating room table. You will be asleep, so nothing, you won't feel anything after that until you're back to the recovery room. It is extremely normal to be nervous before an elective procedure. The sling is a very minor procedure, however, and you should rest assured that the complications are extremely rare. The worst that can happen is some difficulty urinating after the procedure. If you have any concerns or issues, please don't hesitate to call the office, or you can also call me directly on my cell. If you have questions before the procedure, please reach out to the office. You can call our phone number 212-535-6690. Speak to either Janice, Ruby, or Sylvia. If you have other concerns and you want to speak directly to me, you can either call my cell, which is on your pre-operative instructions. The phone number is there, or you can text me directly on the phone. I'm also available by email.